As COVID cases rise again, there's something else spreading among the vaccinated, and that is anger. Dr. Asim Shah with the Menninger Department of Psychiatry and Behavioral Sciences at Baylor College of Medicine joins us live to talk more about this. Good morning to you.
Good morning.
We all know it has been a long 16 months. Now we're dealing with another surge in cases, the possibility of putting masks back on. Is it understandable that those who've gotten the vaccine are angry at those who have not?
It is very understandable because people have tried, people who are vaccinated, about 55, 57% of the people who are fully vaccinated in this country, who have tried to take care of themselves by using the mask, by using sanitizers, taking care of themselves, their families, using vaccines. And now they are told that they can still get reinfected or infected because of people who are not vaccinated. Their anger in some ways is justifiable because they feel in their mind that others are putting them at risk. It is kind of the same thing that in their mind they are comparing it with a drunk driver driving fast and they are in an accident because of somebody else's fault.
All you have to do is look on social media for just a moment and see all the attacks going on. We see the unvaccinated attacking and even insulting on social media those who haven't gotten the vaccine, even by health experts and elected leaders. Is this really the way to fix vaccine hesitation?
No, that's not the way to fix vaccine hesitation. The way to fix vaccine hesitation is to educate people about vaccination. Why are people, first of all, we need to analyze why people are hesitant about vaccination. And the number one reason people are hesitant about vaccine is some people feel that there is no need for vaccination because of whatever reason, whether it is social media, whether it is politicians, whether it is the fact that they feel they're not going to get the disease, or the other reason is side effects because some people feel that they can get infertile because of vaccine, or they feel that even if you have the vaccine, you can get the disease. Once you convince them about all those reasons, then they can get the vaccine. So I think we haven't done a good enough job to convince people to get the vaccine and decrease their anxieties and their anguish or their concerns about the vaccine. That's what we need to do rather than blame people for not getting the vaccine. We have to do a better job in terms of educating the people why they need to get the vaccine.
For most people, it is a personal choice of whether they get that vaccine or not, unless they do work for an employer who mandates it, and perhaps they decide to do it even if they don't want to keep their job. But how can a person manage anger over something they can't control? You can't control what anybody else does.
It's a personal choice, yes, but it is a personal choice for you. So if you're not getting a vaccine, it should not be a personal choice to wear a mask around other people because that affects other people. You don't get a vaccine, that's a personal choice. But if you're not vaccinated, there needs to be some sort of a mandate for you to wear a vaccine around people who, when you go out because you're not vaccinated. And right now that mandate doesn't exist. So if you go out for a grocery store, for a shopping or something, and you're not vaccinated, there is no check and balance. You can go out, you're not vaccinated, you can infect people if you are not vaccinated, and others can catch infection from you. And that's where the problem lies. Because nobody's going to check your vaccine card or certificate and so forth. So if you don't get vaccinated, that's your personal choice. That's completely understandable. But infecting others cannot be your personal choice.
And I am concerned about just anxiety being high right now as we go into this fourth wave. Any final suggestions quickly about how people can just try to take a deep breath and just do what they can each and every day to keep them and their families safe?
I think we have let our guards down too soon. We need to wear the mask for sure. We need to continue to use the sanitizers, keep hand washing and all those things. And we need to most definitely wear masks around people who we do not know the vaccine status, especially when we are indoors. Outdoors may not be as bad, but indoors, if we do not know the status of people who we are around, please wear your mask and wear your mask on your nose, not under the nose, and we need to definitely do that. And that's where the problem is. If you go out in shopping malls in areas where we don't know the status of other people, do wear your mask. It's a very simple thing to prevent this disease. Please do that.
Better safe than sorry. Dr. Shah, thank you for talking to us today.
Thank you.